I wanted to share with you how I've been finding time to exercise and making the best of a bad situation as a full-time family doctor during this pandemic. And hopefully it will let you glean some insight into balancing a busy schedule and, again, making the most of not a great situation when it comes to exercise for all of us right now. Before the pandemic, I was exercising at a big box gym 4 times a week with access to countless pieces of equipment, and it was great. However, in a short period of time, of course, the gyms were closed and I still wanted to exercise. The first thing I did was think about my reason and why exercise is still important to me. Regardless of having access to a gym, I know that I still exercise because it's like the air I breathe. It's one of the most important things in my life for my physical and my mental health. And I know that because of those reasons, I will do anything to exercise regularly. So the first thing I'd encourage all of you to do is think about your reason to exercise. And if you find it, it certainly makes it easier to still stay active if you're not getting it in the ideal form that truly makes you happy. After I did that, I thought about the frequency of exercise per week that I'm willing to commit to. Now, before the coronavirus pandemic, again, I've exercised 4 times a week through medical school, residency, and now in full-time practice. So I've already created that habit and that commitment. And in my mind, I know I still have to make that time 4 times a week for exercise. So for me, that was pretty easy. It was essentially just applying that habit into a new setting, which was the basement of our home. So first I found my reason. Second, I simply applied the previous habit in terms of the frequency of exercise into the new schedule. And then you have to make the best of what you have. So my current goal, of course, is just to maintain my general fitness, but also maintain my muscle with age. And that means for me, I try to hit every major muscle group at least twice a week, if not 3 times a week. So the split I'm using at home, literally with only 2 50-pound dumbbells and some 15-pound dumbbells, is an A-B split. So right now I'm training my legs and my chest on Sundays. On Mondays, I'm training my back and my shoulders and my calves. Clinic gets pretty busy Tuesdays and Wednesdays, so I'm taking those days off or just going for a nice long walk after work. And then on Thursdays, I'm training my legs a second time along with my chest. And then on Fridays, I'm training my back for a second time, my shoulders and my calves. And then again, finding those opportunities to go for walks and getting some extra cardio on the other days. So I've committed 4 times a week with nothing really except 50-pound dumbbells and some 15s. But if you're creative in how you design your workouts, even with a few dumbbells, you can still get a great pump and a really good burn and make it challenging and not lose any muscle for months and potentially even gain some muscle, especially if your nutrition, of course, is on point as well. Now, again, is this making me truly happy as if it would if I was going to a gym with different pieces of equipment? Not quite. But I still feel great after my workouts. I'm wearing my workout gear right now because I just finished a lift in the basement. It's what I have. It's what I have to make do with for the next few months in practice because the alternative is nothing. So if you're in the same boat, my advice would be to start by thinking about why it's worth it to you and why it's worth potentially going into the basement or into your backyard for exercise right now instead of the gym, because it truly is still the best drug for all of us. And then think about your commitment that you're willing to make, even if it's 1 day a week or 2 days a week, or in my case, 4 days a week. Make that commitment and stick to it and put it in your schedule just like I'm doing my own clinic schedule. And then think about what you have at home and know that even your own body weight is enough to really get a good workout in, including a good pump for your muscles. And then motivate each other. Keep posting your videos and stories. I think it's been excellent to see YouTubers like Jeff Nippert and others post home workout ideas because we're all in this together trying to keep it exciting and fresh the best we can and avoid the monotony of having only 2 dumbbells for the next couple of months. So thank you for watching, and we'll see you in the next video.